Assalamu alaikum and hello all. I'm Jamia, first year B.Ed student of Aligarh Muslim University, Malappuram Center. Today I'm going to present a topic on visual impairment. Before that, all of you please do subscribe on this YouTube channel as it was the most beautiful educational platform for the students. Now, let's move on to the definition of visual impairment. The term visual impairment is used to indicate a continuum of loss of sight, which includes blindness, unless it is made clear that the expression is being used in a particular way, where blindness is specifically referred to, and it describes a level of sight loss of children who depend mainly on tactile methods of learning. Vision impairment. It means that a person's eyesight cannot be corrected to a normal level. Vision impairment may be caused by lot of activities. The expression low vision is used with reference to children whose learning and teaching involves predominantly methods relying on sight. Vision impairment may be caused by a loss of visual acuity where the eye does not see objects as clearly as usual. It may also be caused by a loss of visual field where the eye cannot see as wide an area as usual without moving the eyes or turning the head. There are different ways of describing how severe a person's vision loss is. The World Health Organization defines low vision as visual acuity between 20 out of 70 and 20 out of 400 with the best possible correction, or a visual field of 20 degrees or less. Blindness is defined as a visual acuity worse than 20 out of 400 with the best possible correction, or a visual field of 10 degrees or less. Now, the identification and assessment of visual impairment. The identification. Most of the visual problems are identified within the first few months of a baby's life, perhaps by the maternity hospital, health visitor, or parents, although some difficulties may not be appreciated until the child starts school. The vision impairment changes in a child is understandable by the effect of children's cognitive, emotional, neurological, and physical development by possibly limiting the range of experiences and the kinds of information a child is exposed to. Nearly two-thirds of children with vision impairment also have one or more other developmental disabilities such as mental retardation, cerebral palsy, hearing loss, or epilepsy. Children with more severe vision impairment are more likely to have additional disabilities than the children with milder vision impairment. Now let's move on the assessment of vision. The assessment of vision impairment can be made possible by a distance vision test, a near vision test, a field of vision test, a test of color perception, a contrast sensitivity test, and finally an assessment of visual functioning. Now let's move on to the types of visual impairment. Partially sighted indicates some type of visual problem has resulted in a need for special education. Totally blind students who learn via braille or other non-visual media. Low vision is a condition caused by eye disease in which visual acuity is 20 out of 70 or poorer in the better seeing eye and cannot be corrected or improved with regular eyeglasses. Now let's move on to the degree of visual impairment. As we said earlier, the mild visual impairment acuity is ranging from 20 out of 70 to 20 out of 80 on both eyes. The moderate visual impairment is acuities ranging from 20 out of 100 to 20 out of 200 and field loss more than 40%. The severe visual impairment is the difficulty in learning environment even with visual aids, but he or she can use vision to some degree in the learning process. Thank you for watching my video. And one more time, I'm requesting to subscribe this YouTube channel for better education. Thank you.